Everybody, this is Jason the PT. After our first episode, I actually got a couple of responses, one of which was from a friend of mine from high school who's been experiencing some pain and asked if I could weigh in a little bit about what's been going on with her. She's been experiencing some lower extremity pain, right more than left, if memory serves, uh, that she was describing as anterior tibialis tendonitis. On a recommendation, she's been wearing some compression treatment, either stockings or pneumo boots, and has been not running for about 5 months. She stated it got a little bit better, but continues to have flare ups. Now, I don't know how much she was running previous to this, but actually at this stage, it doesn't really matter because after 5 months, and we still have a muscle that's dysfunctional, we have to start questioning why that is still functional, why that's still dysfunctional. So once I inquired a little bit about what else is going on, it turns out she's also been experiencing some lower back pain. And this is kind of interesting because we're having these kind of unknown lower extremity symptoms along with some lumbar pain. And we don't really have a reason for this. And the timeline for muscle healing is long since passed. If it was truly a muscle or a tendon issue, then it should have resolved by now, especially with the amount of rest that she's had. If it's been 5 months and it's still going on, you start to have to question what's actually the dysfunctional tissue. Now, I'm not discounting that the tissue is dysfunctional, but the question is, why is it dysfunctional? And the other thing that's interesting is anterior tibialis tendonitis is exceptionally rare. In fact, in 12 years, I haven't really seen it. Now, not to say it doesn't exist, but it's very, very odd to hear the anterior tib having some problems. So I'm kind of skeptical on that diagnosis. It's, I think, important at this stage to really figure out what that etiology is. And barring anything in terms of out of place in terms of structural flat feet, if we have flat feet, obviously, please go take a look at that because flat feet can increase the amount of shock that goes through the body and create some tissue damage at the lower extremities, or also bad footwear. Bad footwear, also contributes to that increased ground reaction force. So those are the first things I would look for and encourage anybody that's having those types of problems. But if we're looking at back pain and we're looking at lower extremity symptoms, I'm going to bet that there's likely a contribution from the lumbar spine going down into the lower extremities. So I've put up together a couple pictures as well as a couple charts to see to make that connection and to encourage this particular patient to go and actually treat the lumbar spine and then clear up some of the things going on at the lower extremity. So let's take a look at some of those pictures.
Okay, so what we have here is a myotome chart. And it's important to note that every level of the spine has key muscles that it goes to that they innervate and send signal to. Most people are fairly comfortable with the idea of a spinal cord injury, which is a very extreme example. But for example, if somebody was in a car accident and their spinal cord was damaged, let's say at this level here, what will happen is the brain and the spinal cord can still send a signal out to these spinal roots right here. So if this were to happen between L3 and L4, the injured party would still have their hip flexors and they would still have their knee extension, but they would lose anything kind of below that. Now, that's a very black and white example of trauma, but these things do exist on a continuum. So it's not just black and white. So in our patient's example, what is happening is she's experiencing pain, anterior tibialis tendonitis, if you will. And what's cool about this is because if you know what muscle is dysfunctional, you can actually kind of look back and see what level of spine is potentially creating a problem. So if I was a betting man, I would say her back pain is likely at these levels, L4 and L5, because those are the nerves that hook into this. There's a contribution from L4 and a little bit of a contribution from L5. So with the back pain happening and irritating those spinal nerves, it's making it harder for the brain and spinal cord to send a signal through this area and out into the periphery, which is then going to degrade that signal. And if that signal is being degraded, it's going to weaken the muscles and they will be harder to recruit. So you'll start to develop potential issues out at those levels.
Okay, now that we've seen that there actually can be a contribution from the lumbar spine into the lower extremities by way of nerves, what's actually going on at the muscle? What's actually creating that pain? So the next pictures I'm going to show are kind of the theoretical model of how nerve dysfunction will actually create a muscular problem. So let's go ahead and take a look at those slides.
Okay, so we've established that the spinal levels can hook up into different muscles and create problems. But what's actually happening down at the tissue level? What's causing that pain? And how does it come about? Well, we know the patient is likely having problems at around L4 because L4 is those ankle dorsiflexors, which also include the anterior tibialis muscle. At the point of nerve irritability, what it does is it decreases the amount of electricity that's going to go through this nerve. So if there's decreased amounts of electricity, it's not going to have enough push to allow for all the muscles to contract the way that they should. So in this chart here, what we're seeing is a decreased amounts of nerve signaling into the muscle fibers, the anterior tibialis. So these muscle fibers here are not firing. They're weak and they're starting to atrophy. Now, if there is detectable weakness that you can see from the outside, the theory is about 50% of those muscle fibers are not contributing. So if those muscle fibers aren't contributing, the body's response is to then over-recruit what it can. So in essence, you're having half the amount of muscle fibers, the muscle fibers here on the left, doing twice the amount of work. And when that occurs, you're going to get accelerated breakdown. You're going to start to develop trigger points kind of in the muscle here. You're going to increase the healing response, and that's going to lead to that tightness that a lot of patients will complain about. But those muscle fibers also hook into tendon fibers down below. So every muscle fiber has a little tendon fiber as well. And because there's increased amount of stress going through here, that means there's going to be increased amount of stress going along that tendon as well. And that will lead to a tendinopathy. But this is what's important, especially when you're talking about, strengthening a patient that has, weak muscles. Because if you're not taking care of the problem up here, all of your strengthening is only going to be for those available muscle fibers here, which means you're still leaving, the 50% of those muscle fibers that aren't firing. Or you could be contributing to a tendinopathy if it hasn't gotten there yet, because those muscle fibers are the only ones remaining. You're still putting more stress through here and potentially making the patient's problem worse. So it's important to take care of the hierarchy. Take care of the nerve problem here, because it's going to lead to much better response down here.
Okay, now that we've seen how the spine can actually contribute to a decrease in voltage, so to speak, to muscles, and then we actually see what happens at the muscular level when those muscles aren't getting enough electricity, and we're seeing that there's decreased amounts of muscle fibers that are firing. We can now say, yes, there is a true thing going on at the lower leg, but its contribution is really out at the lumbar spine. That's where it's originating from. That's what's happening. That's creating the electrical problem that is then going and creating that problem at the muscle tissue level, where you have some muscle fibers that are firing not at all, and there's some that are firing way too much. And again, if there's 4 muscle fibers there, and you're only getting enough electricity to power 2, that means twice the amount there's twice the amount of work going through half the amount of muscle fibers, and that's going to lead to tissue degradation. That's where you're going to start getting these muscular symptoms. Now, is it possible there's a tendinopathy there? Yes, there's definitely a possibility for that, because those 2 out of the 4 muscle fibers connect to the tendon fibers. So not only are you getting more work across the muscle fibers, you're also getting more work across the tendon fibers. So lumbar spine and the neural contribution can create a tendinopathy. It's just an odd one to get, because the anterior tib's job is really just pulling the toes back when you're going to run. Okay, so it doesn't have a ton of stress like your plantar flexors do that have to propel your body over it and push you forward. There's a lot more stress there. That's why it seems to be a bit of an oddball kind of diagnosis, just because it's so uncommon and based on what the muscle does. I should note, if there is anything local at the ankle, and again, I'm looking at it from a perspective of neurology. If the ankle is stiff, could that create some of the problem? Absolutely. But a good PT should be able to take a look and see what's going on at the ankle and figuring out if there's any lack of mobility there. So really, what's the $1,000,000 question? How do we address this? So there's a hierarchy here. Nerves control a lot. joints also can control quite a bit, not nearly as much as nerves, but they still can locally and around that joint decrease muscle ability to fire. And then there's the muscles themselves, which I think are in my opinion, are on the lowest part of it, only because they have a phenomenal capacity to heal, but they're relatively one-track tissues. They're just made to contract. They really just act on what the joint and what the nerves are telling them. And but they because they heal so well, they should be done by now. They should have been healed already. So it's got to be something in this hierarchy that's kind of flowing down and disrupting those muscles. So first point of order, I would go into the lumbar spine, taking a look at the lumbopelvic mechanics, kind of that I mentioned on the first video, taking a look at the hip mobility, understanding why the back is having a problem to begin with. And sorting that out. Once that's sorted, it's going to improve that neural conductivity to those muscles. It's going to allow for those muscle fibers to fire a little bit better, which will take the stress off. So when people get better, it's because I'm pushing more electricity to those muscle fibers and making everybody contract. So everybody's doing their part versus the ones that are just breaking down. But first, sort out the lumbar spine. Figure that out, get that pain down. That should also bring down some of the tissue irritability. Then actually address the tissues. Go after the muscle belly. Now, I don't believe that this to be a compartment syndrome, but a more thorough examination probably, would be warranted just to rule it out. But it doesn't sound like it because of its being a little bit more on-off. If that's not the case and the tissue irritability is over the muscle belly, I would say try some dry needling. There's some likely some trigger points in there of those overworked tissues which are contributing to the pain. If the muscle belly itself is not tender, it actually is over the tendon. That's where I would maybe do some Graston, some eccentric work on those muscles to improve the tensile strength of that anterior tibialis tendon, and seeing what goes through there. So lumbar spine, then take a look at the ankle and see if there's anything there. That actually should be pretty quick and easy. And then I would then go down and then clear up the muscle stuff with some of those techniques and see where you end up in about 4 weeks. If done correctly, you should start to see some improvement fairly rapidly. But my big thing is to kind of move away from just looking at those tissues. I know that's where the boo-boo spot is, but we need to figure out how it's filtering in and how these things are contributing. And that test retest was important. Test the strength of the ankle dorsiflexors, and then do some lumbar work and test them again and see if that changes. If it changes, you're on it. Now you know you're on it. Now you know you're going to be making some improvements. So take a look at the lumbar spine, clear up the muscle stuff, see where you end up in about a month, and hopefully that kind of gets you through the plateau. I'm Jason the PT. Thank you very much for watching this episode, and I'll see you at the next one.